Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What is scoliosis and how does it develop?
Scoliosis is a sideward curvature of the spine. There are many different types of scoliosis. Some children are born with scoliosis, but the typical type of scoliosis that most people are aware of is the kind that develops when children become teenagers. And we don't really know exactly why scoliosis develops in a certain number of teenagers. There are many contributors to scoliosis, many factors that contribute to the development of scoliosis. We know that a child's gender is important because girls develop scoliosis more often than boys do. But other than that, we really don't know of any major risk factors besides a family history of scoliosis. So the bottom line is that we don't really know why scoliosis develops.
Can you develop scoliosis as an adult?
You can develop scoliosis as an adult, but that's a completely different type. Usually that's associated with arthritis. So it's a different disease entity completely.
How is scoliosis detected?
For the most part, scoliosis is seen first in the school screening program. There's an excellent program across the state and actually across the country where children are evaluated in school for scoliosis. So typically, either the school nurse or the gym teacher will look at a teenager from behind, look at their shoulders, their shoulder blades, and the alignment of their back and pelvis, and they can tell if there's any malalignment or any difference between one side and the other side. And that suggests that there's scoliosis. And under those circumstances, a child will be referred either to their pediatrician or to an orthopedic doctor for further assessment.
What are the best treatments for scoliosis?
What we usually do is we monitor children for progression of the curve. Ideally, when we first notice scoliosis in a child, the angle of the curve is relatively small. So if the curve measures less than 20 or 25 degrees, we just monitor the child every 4 to 6 months to ensure that it doesn't get worse. If the scoliosis does get worse, then we typically apply a brace.
What are the different types of braces that are available?
So there's essentially two different types of braces. In the days when I was training as a resident, the typical brace that we used had to be worn for 22 hours per day in order to be effective. Over the last 15 or so years, there has been a new brace that has developed which only has to be worn at nighttime. So now a child will wear a brace for 10 or 12 hours per night instead of 22 hours per day, which dramatically affected every aspect of their life.
So once the brace comes off, what happens?
Once the brace comes off, we continue to monitor children so that we can be sure that the curve doesn't become worse over time. In a small number of children, even after they've been successfully treated with the brace, their curve still can progress. So we want to watch them for at least another 6 months or a year to make sure that that doesn't happen. If the curve progresses, they might be a candidate for surgery.
How have surgical procedures changed over the years?
Scoliosis surgery has evolved dramatically over the last 20 to 30 years. When I was training as a resident, we would use 2 rods and 2 hooks, and the person who underwent surgery would have to be in a body cast for up to a year. It was horrific for them and barely tolerable for them or their family. In the modern age, we use multiple screws that are placed at critical levels of the scoliosis curve. Children don't wear a brace or a cast after treatment, and they can return to their usual activities within 2 to 3 months. It's a very dramatic difference from the days of the 1960s where scoliosis surgery was first developing.
How does scoliosis affect everyday activities?
Fortunately, for most children, it really doesn't affect everyday activity. For the average teenager, they wear the brace at nighttime and are completely free during the day, so they can participate in virtually any sport. A lot of family members ask, well, is it safe for my child to play hockey or to do gymnastics if they have scoliosis? That's completely safe, and we actually encourage children to be as active as possible because we know that good core strength is effective in preventing scoliosis from progressing in many cases.
Are there ways to cope or live with scoliosis?
Most children live perfectly normal lives even with scoliosis. The vast majority will wear their brace at nighttime, and they're completely free during the day to do whatever activities they want. Even after children have surgery, when that's necessary, they can do most activities. They have difficulty with certain activities like gymnastics or dance that might require a lot of flexibility, but other than that, they can do virtually anything they want to. For example, I was recently contacted by one of my patients who underwent surgery about 5 or 6 years ago, and she wanted to let me know that she was able to participate in lots of activities, and particularly she wanted me to know that she's been running marathons every year with her father. That was amazing to hear.
With new developments in treatment, how has the stigma of scoliosis faded over the years?
Well, many years ago, the type of brace that we used was very evident. Teenagers would wear a brace during the day, and often the brace had a collar that came underneath the neck, so there was really no way to conceal it. And because the majority of teenagers who are affected are women, young women, it really affected their self-image in a very detrimental way. Fortunately, modern brace treatment doesn't involve wearing the brace at all during the day, so whether you're a young man or a young woman, the stigma is completely absolved. People don't even know you have scoliosis in the majority of cases.